And 3, 2, 1. Good afternoon, Nor'easters. My name is Heath Pierce. I'm the director of the Applied Exercise Science program. Welcome, Nor'easter Nation. This afternoon, we're going to be assessing resting heart rate. So this person's been sitting our subject for 5 minutes. They're relaxed, their feet are firmly on the floor, the left arm is being elevated on the table at a very close level to the heart. With permission, I'm going to palpate her radial pulse on the left side. So in doing so, I'm going to press down to the top of the radial bone, allow the fingers to slide downward, and I can feel the pulse quite strongly here. If you're having a hard time finding the pulse, we'll have the opportunity to use a Doppler. We can turn the Doppler on, have an opportunity to come over the radial artery. Make sure we're in a good position. There we are, and you can hear that pulse. I'll take my 2 fingers and apply pressure directly over that area. Once we found the pulse, we're going to count for 60 full seconds. We're not going to count for 10 seconds and multiply by 6, or go to 15 seconds and double the number, and then double again to be at the heart rate. We're actually going to take the pulse for 1 full minute. Make sure your client knows if at any time during the assessment, we're going to try to keep talking to a minimum. That way I have full concentration on the numbers. If anything feels uncomfortable, if you'd like me to stop, please ask. Okay? So I'm going to hit the stopwatch. I'm counting how many beats I feel for that 60-second period of time. Keep in mind her arm is resting on the table. She's avoiding isometrics. Breathing is comfortable. She's not holding her breath. 15 seconds in. Halfway there. Make sure you remind your client to keep breathing comfortable and regular. Try to resist holding your breath. Maintain firm pressure so we get a good response. Last 15 seconds. Important to let your client know where they are. This 1 minute could feel like a long period of time. Last 5 seconds. So her resting heart rate at this point in time during the day is about 74. I'm going to use a pulse oximeter to place over the tip of her index finger. Traditionally, this is not done with gloves on. However, we do have the ability to read through the glove. Get this set right down here on the table. So you can see that her oxygen saturation is around 99. Her heart rate is starting to fluctuate. We're going to let this rest for a moment. It's trying to read through the glove. And you'll see here as we start to let this pause in position, her heart rate is very close to the number I'd referred earlier. Thank you very much, Nor'easters.